protective hand on those overseas and in harm's way that are protecting us and our way of life. Bless each person at this table and give them traveling grace when they leave this evening. In Jesus' name we pray. Amen.
Amen.
And next we have roll call. Please designate that you are here.
Bradley Cobb.
Honey.
Janelle Fulbright. Here. Bill Anderson.
Here.
Bill John Baker.
Here.
Jack Baker.
Here.
Harley Buzzard.
Here.
Julianne Coates.
Here.
Joe Crittenden.
Here.
Jody Fishingham. Meredith Fraley. Here. Don Garvin. China Gloria Jordan. Chuck Hoskin Jr. He withdrew. Curtis Snell. Chris Soap.
Here.
David Thornton. Kara Cowan Watts.
Ahani.
We do have a quorum.
You have before you in your packet the January 13th regular session minutes. If there are no
Second.
First and second for approval. All those in favor?
Aye.
Any opposed? Carries. And next were two reports, and we have some new blood in the room. We got Mr. George Valier, the new CEO of Claremore Service Units. You are the next contestant. Welcome.
Thank you. Nice to meet you. I've met several of you this morning. Good morning.
Good morning.
The only news from, well, first of all, it's good to be in Claremore. My door's open, my phone lines are on. If you have questions or complaints, I don't shy away from complaints. Please feel free to call or drop by. Like I said, the door's open. For the last month, this is real short and sweet. Our visits are up 26% through the hospital. We're still inpatient. Census is running about 30% occupancy. Our collections are actually up 6% over the first year to date from October 1 to now. So that's looking a little bit better. I questioned that. One of the problems I think I saw when I first got there was that we only have is the number of people who have resources. We're looking at about a 10% Medicare, 10% Medicaid, and 10% private insurance out of our total user population, and that's not very many at all. We are billing all that we can. Our 120-day age summary is at 3%. So by 120 days, we have 97% of all those collections in or closed out. So we're doing absolutely, the best we can that I can see right now. Under contract health activities, to date, we've denied 236 cases and 824 have been classified as unmet. So we're looking at about $3 million worth of people turned away there. We just got finished with our Joint Commission survey. We had nine direct findings, and 15. The 9 findings we have 45 days to correct. The 15 we have 60 days to correct. We've actually challenged 3. Already had one of them tossed. Waiting on rulings on 2 more. No major findings. Most of them I call housekeeping issues. For instance, fire drills. One of the fire drills wasn't documented, so we took a hit on that. One of the new life safety standards is that all the firewalls have to have a specified retardant filler in those holes anytime you go through one of them. And our firewalls were done, but they came back in the walls that weren't firewalls, and though we had concentrated on the firewalls, so needless to say, the ones that weren't firewalls hadn't been done, and they hit us on excuse me, all the findings were stuff like that. The one thing that had gotten out that we had gotten shut down, what that came from was there was a problem with the humidity in the operating room in OR. It was too low. They had put in a new switch in it a few weeks earlier because it had been too high. Now it was too low, so the hospital just shut OR down for 24 hours, had somebody in overnight, changed it, and we were back up and running the next day. So there was no problem there. Are there any questions?
Do you have any questions? Oh, well, there's one.
On the president's stimulus bill, did the Crown put in for some construction or any improvement needs there for the stimulus?
As far as I know, our engineer put in, contacted area office for the roof and HVAC that I know of. Now we have some other, and I learned this after I got there, there's been a master plan for that hospital for the last 10 or 12 years that nobody's bothered to touch or look at. And I've already had I've made an appointment with the architect at area to come down and knock the dust off that, and we need to get moving on a couple of those projects because I think they would really help.
Thank you.
We have any more questions? Thank you.
Thank you.
Next, we have Melissa Gower from Cherokee National Health Services.
Good morning, everyone.
Morning.
I submitted a written report, and in addition to that, an update from PACE this morning, because I didn't have numbers in that report when it went with Cherokee Elder Care, but it continues to grow at our planned rate to reach break-even operation by the end of the fiscal year. As of March the 1st, we will have 21 participants. And we have several other potential enrollees in the pipeline. So that's very good news. We are enrolling and getting participants at our planned rate. So it's actually nice when you do a feasibility study and you meet your projections. So that's going very well. There was an article on rural PACE programs in the National Magazine of the American Association of Homes and Services for the Aging. Don't know if any of you saw that, but Cherokee Elder Care was one of the 3 programs that was in that article. Also, there was an article that I saw in the Daily Press about the Valentine's for Veterans that they did, and it featured their oldest participant. I forgot exactly how old she was, but it was a good article on Cherokee Elder Care. So if you haven't been by Cherokee Elder Care, you should try to do that sometime. Feel free to stop in anytime, Monday through Friday. 7:30 to 5:30 is their day operations hours. They'd love to have you and give you a tour. And I probably told you last month I went down, and I try to go down once a month and visit with them. And I played bowling on the Wii with one of the participants, and that was quite an experience. Also, we are continuing to work on our accreditation. We are going to have to, currently our clinics are accredited by AAAHC. As the hospital is joint commission, we're now going to have our host system will be joint commission. So we're working vigorously trying to prepare for that accreditation. They're unannounced surveys. Since there's a change in ownership, we're quite positive that they will be by our facility as they went by Claremore several weeks ago. So we're trying to be ready for that survey, and we have a conference call with them this week to answer some of our questions about a change in the ownership and system. Our staffing, we've hired We've been able to recruit and hire 17 providers for our health system since October 1st for the first quarter. That was our record high, and I'm sure that was because of the vacancies that we had at Hastings. The clinical director there told me the other day that he had interviewed more providers in the last 3 months than he had all of the years he'd been with Indian Health. So that was a good note that, and you all were advocates of us getting a full-time health recruiter, and it's been a successful effort, and so I appreciate your support on that. Our challenges at Hastings has been contracting issues. Under our Medicare, through consultation throughout the assumption process, we were guided by CMS to do a change in ownership, which meant that the Medicare billing number for Hastings under IHS would actually stop September 30th, and then we would be reissued a new number to start October 1. That process still has not been approved. We have decided, and through consultation with CMS, that we could probably get our number, our Medicare billing number faster if we do a transfer of ownership, and those are technical terms with CMS. So we've submitted that, and we're still waiting on our Medicare number. We do not have a Medicare billing number for Hastings yet, which means we are not billing Medicare. We will get that number. We hope that it's very soon. We have lots of people working on it. Went and met with the director of Indian Health Service in Rockville, Maryland about it. He's talked to the CMS director. So we're working very hard trying to ensure and get that Medicare number. The good news, so the bad news is that Medicare revenue does not show up. The good news is that we'll be able to go back and bill from October 1 for all of those Medicare services that were provided. So we will catch up during the process when we get our number. So that's kind of a bad news, a good news situation, but I want you to understand that there won't be any revenue loss. We will be able to go back and bill for all of that and get that revenue in. It also has affected our clinics, because our clinics billed under Hastings number also. So, but the same circumstance there is that we'll be able to go back and bill for all of that. We also, for the other contracting issue, was for what we call point of sale agreements, which are pharmaceutical agreements to bill pharmaceutical companies for prescriptions. We have found there was a change in their contracting regulations. We anticipated, and through consultation was going to be able to do an addendum to our agreements to include Hastings. October 1, they had a change in their contracting regulations, which would not allow us to do an addendum, so we had to do new agreements. We have found a company that actually has those agreements that we can just contract with, and we'll have those agreements in place. We've done that. We finished that. That contract is in place. Got an email Friday that tomorrow we can start billing all of those. So the POS pharmaceutical issues are now resolved and taken care of. So that's good news on that part. So our revenue report that is in your packet does not look as good as it always has previously, but it will start coming up and showing up on there, and we will get caught up. I think that's all I have. If anybody has any questions.
Councilman Jordan?
Melissa, on Patty's, if the numbers come up to, I think, in 45, the break-even number for
Yes.
the number of patients
For
out there.
year one, yes.
If we get that by the end of the fiscal year, I think was what you projected, they will not need then our infusion of the $750,000 for the next year?
For the following fiscal year after that, that should be correct.
So they're gonna come to us and ask for another $750,000 this next year.
I don't know. I better not answer that. I better find out.
If you could look into
Okay.
that.
I will do that.
I kind of had in my mind that once they hit that break.
Yeah,
even, that
the reason I hesitate is because, you know, the plan was that after 18 months, that then they would start build on the second site, which is in Adair County. And so I'm not sure how that works with starting the second site. That's what I got to check on. But I'll find out and email you back.
Then I had another question, which is not something that you've talked about. There is a disease for premature children, and Meredith will have to tell me what that disease is.
RSV, I think.
RSV?
Yes, that they can take shots for. And apparently our insurance, if you're employed here, our insurance will not cover those shots. And I'm wondering if we can cover those shots for the premature children. They have to have them, I think, within the first 10 months under some pot of money that you might have.
Can I interject something? I've had a question similar to that on HPV, similar to the program they do in Texas. You
We
familiar?
provide HPV.
Yeah, okay. I had a question about that, and I didn't know how to answer it. So if you could.
Okay. I saw an email, and I think it was from Michael Botello about the insurance piece of that. And so I sent that to Dr. Grimm and Jeff Sanders, our pharmacy director, to see if there was some assistance that we can do to provide that. And I haven't seen what the response is. So let me follow up again on that and get you an answer.
I've had some constituents ask about
Yeah,
that.
I remember that.
Apparently it's a high risk.
It was for the premature,
Yes.
yeah.
Apparently it only happens to the premature first.
Right.
And I think they missed the deadline. It can happen up to the first 2 years of their life. And these folks missed the deadline by like 6 days.
Yeah, I remember
And
seeing
then
that.
they wouldn't.
And I remember Dr. Graham talking about it. So let me follow up. I'll get you back an answer.
Thank you.
Councilor Baker.
Yeah, Melissa, you touched on the problems with the third-party billing and the pharmacy. But, you know, I'd asked for a report on, you know, what have you billed, what have you collected, and what are you going to be able to back bill or bill later. Did y'all come up with that report?
I have a report on what we've billed and what we've collected,
Okay.
which is what I was told that you asked for.
Oh,
I don't have, on what we'll be able to come with later, it'll be everything that, all the services that we've provided. I mean, I don't have a list of all the claims until they're submitted.
yeah.
So I won't have that
Well, I
information.
mean, fully half of our money at Hastings is third-party billing. I mean,
That's correct.
I mean, when it's...
Well, it's not just Hastings, it's our clinics too.
Well, and clinics as well, but,
Yeah, it's
fully half of
$60
all the
million,
services we
I
give
think.
relies on getting
Absolutely,
this right.
absolutely.
And I don't know how long our cash flow will hold out waiting on this.
Well, we have our base funding that's gonna carry us through until we're able to collect that.
Have you-
I've talked to Callie about it, and absolutely, she's already emailed me, and so we're
So, I mean, it's a great
working on it.
concern.
Oh, absolutely,
And,
absolutely, it's a huge concern, and I've talked to Dr. Cobb about it. We've, you know, it's very, I mean, that's why I went to Rockville and met with the director, and they've hired a new, I don't know if any of y'all knew Dorothy Dupree, but she was the CMS, Joe knows her, she was the person at CMS that kind of facilitated tribal clients.
Right.
And she's the one that guided us through this whole process. And then, lo and behold, in September, she leaves CMS and goes to Tucson, area director. I don't know if you knew that, Joe.
No, I didn't.
And they just now hired Kitty Marks. Some of you may know her. She was the legislative director at NIHB. So we've now got her involved, and so we're working diligently. The Secretary of State is assisting us on it. The chief has made a phone call. I mean, it's very serious.
Now, on another note, and, you know, we deal with rumors every day.
Sure.
But I just got an email, and they want me to answer them, and I'm going to leave out the inflammatory parts and all of that.
That'd be nice.
So it'll be a little, I'll be a little slow on asking the question.
Okay.
But apparently there's a rumor going right now, and for lack of using anybody's names, administrative IPA employee John Smith informed employee Jane Doe that the Cherokee Nation was not going to be renewing the IPAs. And then it goes on to say that giving Hastings Hospital to Telequa City Hospital, which I don't think is even a possibility, let alone a probability. Employees would be out of a job because Telequa City Hospital doesn't want IPA employees working for them. Administrative IPA employee John has already made plans transferring to Claremore, as is Mr. McLemore. There is no time frame given, but it's supposed to take place. My question, a Cherokee Nation council member, is there any truth or rumor concerning Hastings Hospital and the IPA? And then it goes on to say that we told the housing authority employees one thing and did something else. But anyway.
Not true.
Just absolutely all IPA.
I mean, if you're asking a generic question, the answer is not true.
Not true. And
yes, and that's how I would respond.
We are fully intended on everybody that went IPA re-upping their contracts.
Well, you know, IPAs are for 2 years, so, I mean, I haven't even thought about IPAs. Okay. We're into this for 4 months.
Okay, I
so if you're talking about if you're talking about a specific person, you know, that's having discipline issues, then I don't know that.
And I don't even have that.
Generic is not true.
Okay, good enough. I'll answer.
I wanted to interject something real quick on the CMS issue, and then I've got Councilor, were you finished?
I am finished, yes, sir.
Then I've got Councilor Buzzard and Councilor Jordan. If you're not familiar with CMS and how that works, I had been a practicing optometrist for 12 years and decided to open up a solo practice. And I had had a Medicare number for 12 years. And when I knew I was going to move, I called, not me personally, but my insurance person called and said, no, this is going to happen. We're going to make this move. What do we need to do? And they basically said, oh, you're looking at 2 or 3 months. Go ahead and submit this, and by the time you get moved, this will be in place. And, well, we did everything absolutely by the book, and I moved. And then CMS came up and said, well, you know, it's going to be 6 months. We're going to have to process this, and you'll have to refile it. And I had a Medicare number for 12 years, and I had to get a new one. I could not carry my old one with me, even though I had filed on it for 12 years. And it took me 6 months, and I did not get reimbursed on all those patients I saw for a 6-month period. I lost that money. So it is a little bit different here. I question, how do I put this without having the wrath of CMS come down on me? But they're pretty much going to do what they want to. And you're between a rock and a hard place, and they know it. In this situation, I think we're fortunate that we can go back and bill all that and get the money. It's not a money loss issue. But I just wanted to throw that out.
And you can back bill for 12 months.
Yeah. I couldn't for some glitch that they informed me there was a glitch. I couldn't.
It's one of those new regulations that we got caught in.
Councilor Buzzard, you're up.
Melissa, I think I've asked this question before, but I'm going to ask it again to get clarification on it. I've had a couple of people call me. This one guy had worked as a truck driver for 25 years and had insurance and always went to our clinic in Jay to see the doctor. They billed his insurance company, and now he's come up and he says he's disabled. He goes back to his clinic, doesn't have insurance now, but they will not refer him or give him any type of piece of paper to say that he's disabled. Is that our policy that we won't get involved with ruling somebody disabled? He's at the point now he doesn't have a job, he can't pay for an MRI, he can't go to a private hospital, so he depends on the clinic to help him. And he says if he tells me he can't get anybody to write a paper saying he's disabled.
Just give us his name and we'll help facilitate it.
Good.
But our providers do not determine disability, okay? Social Security determines disability. We can provide medical records to them, we can provide that kind of information, but we do not sign a sheet that says someone is disabled, because we don't determine that.
So you would provide the information and they would determine the disability?
Yes, so if you'll give me his name later or email it to me, I'll get somebody to talk to him and see if we can help facilitate something for him.
Okay. And that's the other question. I had a patient call me the other day, said that he tried to get an appointment for dentures there at the clinic in Jay. They said they stopped making appointments. I didn't know if you were aware of that or not.
I'm not aware of that.
I told me what happened before that. They used to do it I think once a month on Wednesdays. People would call in and get their appointments. They would call in and said they don't make appointments like that anymore. And I said, well, you hadn't said anything about being low on funds, so I think the funds are still up to date.
I don't know. I don't know the
If you
answer.
check on that, I appreciate it. Thank you.
Councilor Jordan.
Melissa, on that report, that you're going to provide to Mr. Baker, would you also add a column and tell us where we are on third-party billing on private insurance companies?
It has Medicare, Medicaid, and private insurance.
Okay. Could you also give that to me?
Sure. I'm going to give it, I've given it to Dr. Cobb and he can distribute it.
Councilor Soak.
Yeah, let's also recently attended a Healthy Heart Day at the Homo Health Center. Really do appreciate the staff going through and putting that on for the community. There was a lot of people there and actually witnessed a couple of the, I think the home health organizations come in and they were doing some sugar testing and things like that, checking blood pressures and so forth. And there was a couple of people that had attended that they identified as, needed to follow up and advised them to seek medical attention and things like that. So that was really good. But there was a couple of organizations or personnel that may have been affiliated with your group that had some visual demonstrations of things that demonstrated the type of fat, the food, and so forth. And I was just curious if we were to seek those to be introduced into the school system or something like that, who would be the contact to set up some type of co-op with the school systems to be, say, at the high school one day at lunchtime, go in and set up a table and just be available, because that's really kind of at the level where you start developing a lot of your choices, let's say, and your parents obviously provide you a lot of your eating habits when you're in the household, but when you get to that high school or junior high level, you kind of start having choices about what you eat. And I'm just curious who would we contact if we were to try to coordinate something like that within a particular school system?
Well, those relationships are already established through
Right.
our Healthy Nations program.
Right.
And so it would be the health educator in Mays County, but I can initiate that. And
Okay. Yeah.
I'm curious first what they already do, because they may already do.
Right, and if they do, it'd just be neat to be advised of that.
Okay, let me follow up on it and I'll get
but
back
I really
with
do
you.
think that there's an opportunity there. From what the demonstrations that I saw, if they were to set up at a time at lunch or whatever, and just really, focus in on that,
Right.
would be helpful.
Okay.
Are there any more questions? Doesn't look like there's any more questions. Appreciate
Thank
it.
you.
Thank you. Old business, there appears to be none. New business, there appears to be none. The one announcement is tentatively our next meeting for the Health Committee is Tuesday, March the 17th at 10 a.m. Are there any more announcements? And I would look for someone to move for adjournment.
So moved.
First and second, all those in favor? Aye. Any opposed? Motion carries. We are adjourned.